There are few professionals who've had to endure such complexity over the course of the last 5 years, quite like those in the healthcare industry. Between the challenges of a global pandemic, navigating government policy changes, and now being faced with one of the most notable employee attrition challenges of recent years, there's really no shortage of obstacles in front of some of these leaders. So now more than ever, healthcare organizations have to hone in on the experience on their employees and make sure they're feeling supported and engaged. And so, how can those leaders go about prioritizing the right employee initiatives? How do they go about getting the funding and project support that they need to achieve and accomplish those initiatives? And then, how do they go about ensuring that there is very clear executive alignment and understanding that that investment is ultimately going to positively impact the bottom line? So, to help us in unpacking all of these questions and so much more, we have the pleasure of being joined by Heather Hudnall, who is the Chief Clinical Officer at The Groove. They are a scaling IT consulting firm with loads of expertise, especially in HR systems. And Heather specifically, she has such unique experience spending years on the front line herself as a nurse, providing care and leading nursing teams, and now advising organizations on how best to set themselves up for success and their teams up for success when investing in HR and IT infrastructure. So, welcome to another episode of the Blink podcast and enjoy the conversation.
Heather, welcome to the Blink podcast. We're so excited to have you.
Thanks for having me. I'm excited to be here.
Awesome. Before we kick into gear here, tell us, how was your summer? What did you get into? Any travels? Any trips? Anything notable?
Nothing too crazy this summer. I love the water. I live in Missouri, so unfortunately we don't have like mountains or oceans, but we do have a lot of fun lakes. So did a lot of hiking, boating, skiing, hanging out with friends, and of course, living in Kansas City, lots of barbecues. So
yeah, there you go. There you go. That feels very on par for what our ignorant New England minds would go to for a proper Midwest summer. So that's awesome. Well, we're super excited to have you. Obviously, there's going to be a lot for us to unpack. We're just thrilled that the audience will kind of get to hear your journey, hear your perspective from kind of both sides of the coin, having kind of lived on the front lines and now guiding businesses kind of through this experience with their front lines. So much to kind of dig in, but I would love to start on the front line in your experience as a nurse. Would love to you share for the audience a little bit about like on your background in nursing, kind of your the different departments that you worked in, and kind of going from being a nurse on to the management side on with nursing as well. Would love to share some background there.
yeah, I would love to. So I have a unique background from what I hear. Started my career in nursing at the bedside, working at a local hospital here in Kansas City where I live. And I think that experience has shaped everything that I do today. I worked in a lot of high acuity units where every second mattered, so I saw firsthand. I know we're talking about technology today and delivering better experience. So I saw and experienced firsthand how technology either supported my work or it got in the way. I've been through multiple go lives with new solutions, devices on multiple different units. So I've worked in med-surg, tele, CVICU, kind of seen it all. So I know every unit operates a little differently. So going through those go lives, I got really interested in the tech side of healthcare because oftentimes I was told, oh, this is going to help you deliver better, safer care. And a lot of times, I'm just going to be honest, it did the complete opposite. Created more workarounds, created more frustrations. Instead of supporting the work I did in my workflows, it actually created more frustration. So I then moved into leadership and eventually health IT. That really wasn't planned, but based on my experiences, I saw it as basically an opportunity to leverage all that real world bedside experience so that I could create technology and solutions that clinicians actually wanted to use instead of it being thrust upon them, technology that actually helped them deliver better, safer care. Basically, I just wanted to be a part of the solution to fix the systems for all caregivers and ultimately their patients.
Yeah, that's great. Would be curious to hear just, I know personally from many of my friends that are in the field, I always am pining for, you got any good nursing stories? Like any like highlights of like a ridiculous day or, some, shift that was particularly memorable for you? I'm sure there's many, but
I wish, so I had a lot of really memorable shifts where, I got to hold my patients' hands and, their families, and my patients would show gratitude and say thank you for saving their lives or helping them through, the toughest time in their lives. Cause, very often people aren't at the hospital for anything, a positive experience. But a lot of times the shifts were crazy. I just learned to expect the unexpected. I remember I was about 6 months out of nursing school. So you're still a baby nurse at that point. You're still learning a lot. And I was working in a med surg unit where typically nurse patient ratio is 6 patients.
Okay.
I ended up getting 8. So even for a senior nurse, that is a lot. I did not really have time to even think about what I was doing. I was just running from task to task to task. Unfortunately, I had a patient start declining, had to call the stat team. As I'm dealing with that, I've got patients on the call light nonstop. I almost had a breakdown. Luckily, I had, a good team there, but that wasn't a one-time event. That is a very common occurrence that, I had and even nurses are still having today. It's unsafe. I blamed myself for a while, like how could I not see the signs of, my patient declining? But now I know I should have never been put in that situation. That was very unsafe. Understaffing. I could talk all day about understaffing and what it does, but it's harmful to nurses and patients.
Yeah. It's so funny. It's somebody who's obviously not only 2 boys, so I've spent at least a fair bit in the emergency room over the last few years, but it's obviously not nearly understanding kind of the depth of what that day-to-day entails, only through, I think I said to Adrienne before too, only really through the lens of like watching it on TV, and, seeing shows like ER or The Pit and like that being a reference point. And I'll always be very curious to hear from somebody who's lived a life, like how accurate that really is. But one thing I've actually seen and read in reviews is that the Pit specifically actually does a pretty good job of dictating like the balance between the patient care and like a bedside elements of the job and then the administrative components. But I'd love to hear the retelling from your perspective of what does that, balance really look like? How much time are you spending, between patient visits, filling out paperwork, doing administrative things, logging into systems? Like what does that really look like day to day?
Well, first of all, I'll tell you, I love The Pit. I think it's
Good.
accurate depiction of what actually happened.
Said that.
Yeah.
Yeah, it seems quite real. It felt quite tangible, and I watched it in succession episodes. I'm like, oh, I need more. It's just so good.
Yeah, I love it. I can't wait for season 2. I hope they have a season 2, I believe, coming out.
Yes, I think it's January. Not that I'm tracking or anything, but yes.
So it was always a balancing act. I'll just say that prioritizing tasks, making rounds, passing meds, making sure my patient and family needs were met. And you hit the nail on the head. Endless documentation. I mean, a lot of times I just felt like my patient was the computer. Luckily, we got the workstation on wheels, so you could be a little bit more mobile. But a lot of times that had connectivity problems, so then you were going and tied back to the desktop. So that took a lot of time. On top of that, logging into multiple different systems with different logins, especially once I got into leadership. I mean, I just to create and manage the unit schedules, it was probably 5 or 6 different systems. And that's really risky. I mean, risk of error, missing something, time consuming. It's just very frustrating. I mean, my time was better spent, getting that done quickly so then I can go support my patients and my staff.
Yeah. Yeah. We definitely hear that often. I'm sure from the customers that you're supporting, it's like the importance of making that as simplified and easy as possible is like really the crux of, getting to the most optimal employee experience, but also the most optimal patient experience. So that reduction in, what feels like minutia, but necessary work, certainly, because obviously keeping a close log on everything that's happening and everything pertinent to that patient is critical, but not letting that distract from the actual care that's being provided. So,
Right.
yeah, it would, I think that, it's just really helpful to get that context of, okay, this is the reality of the day to day. Like, these are the things we have to do, and how, at times that might not be the most optimal kind of course of the day for the nurse to follow. So,
Right. Anything that takes away from patient experience,
Yeah.
patient family experience, it needs to be really worth it
Mhm.
and as efficient as possible.
mhm, mhm.
Exactly. Yeah.
And I guess maybe just looking back, like it sounds like we've been able to tap into again, that juggling act as probably being one of the more challenging elements of your day to day. But anything else that you would note as, like the highlights of the day versus kind of the lowlights of the day? Anything else that we maybe haven't touched on there? Obviously, the gratitude from patients being a huge kind of, takeaway and highlight from that experience. But anything else that you would note as, again, like highlight, low light?
Yeah, I mean, just knowing you made a difference in someone's life, and you could, go home and say, I actually saved someone's life. Unfortunately, we would have code blue situations, especially when I worked in ICU, and um, it was awful to lose a patient. I mean, that is the worst thing ever. I actually, the whole reason I never went into labor and delivery like I thought I wanted to when I was in nursing school is during my labor and delivery rounds, I had a patient who went into preterm labor with twins. They were, I think, 19 or 20 weeks. And I was in there when the baby started coming out. And I literally held this helpless infant in my hand who was no bigger than my hand. There was nothing we could do. I just had to watch these babies die. I mean, that was horrible, horrible. So, as you know, in healthcare, you have high highs, but you have low
Yeah.
lows. So you're either losing patients or you're saving lives. So it's unexpected. You never know, what each shift is going to bring.
No,
Absolutely. Yeah, it's such a hard job. It's a really difficult job. And I think we've seen so many changes too to this industry and this world over the past 5-6 years. I'd be curious, kind of in your, from your perspective of being on the front line at that point in your career and now kind of on the advisory side, how do you kind of see the landscape and how those changes have impacted the industry today?
Well, I think we're at a breaking point. I think everyone has seen that. I mean, we were dealing with a lot of challenges prior to COVID, but I think COVID exposed a lot that we were dealing with that just were behind the scenes and people did not understand. I know like turnout and burnout are higher than ever. And what's sad is many nurses aren't just leaving jobs, they're leaving the profession entirely, which really scares me because I've seen a lot of studies that predict that the US alone will be short by over 1 million nurses by 2030. So that's 5 years away. The workforce is just tired, burnout, frustrated. I know a lot of them that were on the front lines in COVID, they said they're dealing with PTSD. I mean, they experience like war-like conditions working in those environments. So at this point, we just need to listen to them. I know they need support. And a lot of them, they just want to have their voices heard. So I think it's time for us to listen.
Absolutely. How do you see, kind of thinking about, what our roles are? How do you see technology playing a role in that effort in addressing some of these attrition and kind of burnout issues?
I think it has a lot of impact. If the digital experience is poor and adds friction, I mean, that's going to make every shift and task feel heavier. When caregivers can't find schedules, access policies, get the data they need, communicate easily, it's going to continue building that frustration. It's going to accelerate burnout. It's going to drive people out the door. I've actually seen many incredible nurses walk away, not because they didn't love nursing, but because all the broken systems, the lack of leadership, support, lack of tools, just makes the job unsustainable, and they're just burnout and tired and ready for a change.
Yeah. No, it's interesting to think about, like, you can't change kind of the actual core of the job. And that's why it's so important that we have people that want to do it and are feel called to it. So where can we identify how to make the kind of not superfluous, but the extra stuff, the logistical stuff, the administrative things, that kind of open feedback with leadership. How do we make that easier, more seamless, more positive? I am curious if you have any kind of stories or memories of where systems broke down during your time on the front line, and kind of what the impact was of those instances.
Yeah, in my years since I've been doing healthcare IT consulting and advisory implementation, I've seen a lot, because that's what we're there to do, is evaluate, implement, deploy systems, see how it's working. And I'll tell you, I've been on site when systems have failed, and it is complete chaos. For example, I was at a client site in the NICU when their EMR went down, and some of these nurses have never dealt with paper before. I mean, they've entered a profession where everything's just been electronic and automated. So they're scrambling with paper. They're trying to figure out, what do I need to do and make sure nothing gets missed. But you don't really know for sure, because everything is in electronic form these days. So when you can access the system, it's not just an inconvenience, it's actually a patient safety risk. I mean, the tech these days is not separate from care. It basically is care.
Yeah, it's a really good call out that they're not distinct from one another.
Yeah, absolutely.
How do you see kind of outages like that kind of impacting this larger issue around, burnout, morale, ultimately leading to attrition? I know we've kind of gotten at this, but would love to kind of hear your perspective.
So, those the bad experiences and poor systems, it leads to higher levels of burnout, turnover, and now we know turnover is very expensive. I mean, think about all the recruiting, training, overtime, agency staffing, poor outcomes. It all adds up. A lot of data actually shows that hospitals lose an average of $65,000, I think, for every RN who leaves. And that number will go up if they have specialty skill set, certification. So when you can deliver them a positive experience, they feel supported, they have the tools that they need to deliver better, safer patient care, they will stay longer, they provide better care, and they can actually save the organization millions. So, I mean, it goes beyond just financial, it's emotional. I mean, it has a massive impact on reimbursement and the bottom line. If you just deliver a positive patient experience, give them the tools they need that are simple, easy to use, and makes it easier for them to deliver care, because that's what they all want.
Yeah, and I'll be interested to unpack, because that through line of the impact just from an attrition standpoint, and there being a very tangible dollar value on what it actually will cost the organization, the hospital system, the business to lose that RN, whether it's from all this compounding effect of the overall experience. I'd be interested to hear how else, when you're advising customers and working with your clients, how do you go about kind of unpacking that business impact that ultimately the employee experience can have on the bottom line? What are the other kind of metrics or measurements that you kind of bring to the surface to help them try to solution against?
Well, employee engagement is a big one. If they're not engaged, there's a lot of data that shows that, the patient experience is going to decline. And when you look at that, you can see lower HCAHPS, you can see poor quality outcomes, which you're not getting optimal reimbursement. It's affected the bottom line, your reputation. So starting with, I always say, just take a walk in their shoes. That's really how you're going to uncover everything. There's a lot of leaders who I don't know the last time they've actually put scrubs on and walked around, because every organization, it's a little different in each unit. So get out there, walk around, observe their workflows, ask them what they need. And the employees will tell you. So don't guess anymore. Just go ask them and they will tell you, especially nurses. We are so happy to give you all the feedback and insights that you want. It's really that simple.
Yeah. It brings up a good point too, because obviously we've, from a technology and infrastructure standpoint, we've talked a lot about like the, the burden and friction involved into getting into systems to, catalog information, properly kind of, recant anything that's happened in that patient experience. And then there's this kind of other digital elements of the job around like overall communication. So what's happening in the hospital? What are things, whether it's shift related or just general happenings within kind of the hospital system on the whole? Like what are some of the mechanisms that are like standard for some of the organizations that you're working with now on how they receive information, whether it's kind of more the day-to-day stuff or the more urgent things, like, perfect example of that system outage that you referenced earlier. Like, was it just everyone kind of running around the hospital and saying the system's down? What do we do? Like, was there what kind of infrastructure have you seen clients kind of successfully leverage to help with that kind of communication component?
It's not very good. I'll just be honest. That's
the snippet. That's all we needed.
Okay, good. I was like, like I said, it's pure chaos. There are people running around. Everything's connected, and when those systems go down, like especially the EMR, they're basically using that for everything. They have to go back to making phone calls on landlines and printing out labs, and if they can get them. They use the overhead paging. It varies, and it's pure chaos. Like, it's not great. Their downtime procedures, backup plans, if they know what they are, hospitals just need to get better at planning, because you have to expect the unexpected. That's just what I've learned.
Yeah. And into that kind of additional kind of data point around, you said, like, just walk in their shoes, go around the hospital and ask them for their input, their feedback. Have you seen clients kind of implement systems or do a great job at actually kind of collecting that input, getting those kind of like pulse? There's always the kind of the annual survey, right? Which, is a necessary kind of element of really any functioning business, and remind a healthcare, whether hospital or other institution. Have you seen customers kind of do a good job at, maybe collecting that feedback, that information, that inputs, like more on the fly, more consistently? Like, would be interested to see like what you've seen done well in that capacity.
Yeah, I definitely think they need to go above and beyond just the annual survey, and it needs to be more frequent touch points, maybe shorter surveys more often. And I've seen one client that I worked with and it was great because I got to go and help them, and I loved it. They created a quick survey, and we did monthly roundings where they handed a tablet to the workforce on the units. Just very quick, short survey, just simple questions, but they were also talking to everyone. So not only were they gathering the information, electronically from the survey, they were actually jotting down notes and going above and beyond just what they were capturing. I mean, it was amazing, the feedback they got, the insights, and from that, they were able to develop other programs. They're like, we're seeing a common challenge in this unit with this role. We should probably roll this out and think about, I mean, they just had all sorts of plans and things that they could roll out quickly to fix some of the challenges.
And the impact that has on an employee who's providing feedback to then actually see a tangible change, like just what that can do for morale, just feeling supported. I mean, that's huge. It's one thing to collect the information, but to actually see something come out as an output on the other side is just critical. And obviously we talked a lot about like the nurse perspective. I think, curious to understand like how there's some nuance within those employee experiences too. So I don't know, Adrienne, if you want to kind of dig in on the, that kind of like unit by unit or like role by role kind of differentiation.
Yeah, curious if kind of what your perspective is in having both worked in these kind of different roles and functions and now advising across them. I would imagine that everyone's needs are a little bit different.
Right.
I think, you've commented on that before. So kind of would be eager to hear how you see those needs differ and why it's important to kind of solve for each of those different kind of days that people have, whether they're a doctor, a nurse, support staff, kind of across the board.
Yes, love this question because that's huge and that's something that people miss.
Mm-hmm.
I always say, not all healthcare workers are created equal, not even nurses. We all function different depending on where you work, the different unit, different role. So I've had some clients think that just because this works for a physician, it's going to work for a nurse, right? Simple. No, that is not the right assumption to make because nurses and physicians, they work very differently. Nurses are hands-on, moving constantly. They need tools that work in real time at the point of care. So a system that's designed for physicians, it often creates barriers for nurses. I've actually seen systems built around physicians that left nurses scrambling with double workarounds and completely exhausting. So that's why listening to each role, understanding your unique needs, workflows, challenges is critical. And that goes the same for different units within the same organization. I mean, each one has its own patient population, workflow, standards of care. For example, an ER nurse needs speed, simplicity. An ICU nurse needs precision, depth, and then home health. So that's a completely different ballgame because we're outside the four walls of the hospital. They're navigating a lot of autonomy with EVV requirements in the field. So organizations, leaders, they must understand that all different voices should be included in designing tech and the solutions. They have to flex to fit the needs of those different environments and workflows and whoever is using the solution.
Yeah, seems like it's not really a one size fits all approach.
No.
Mm-hmm.
Many do that though. Many think the one size fits all for work.
I mean, how have you seen, I mean, outside of your advising and helping them to kind of see the light of, ultimately the needs kind of day-to-day need ultimately are different. Is it survey collection? Is it just a really in-depth understanding of the like personnel? Like how does somebody unpack what those needs ultimately are? Like, how do they, if they were to embark on a project to really kind of, all right, we need to kind of dialogue what a nurse's experience across a range of different departments versus a physician versus, and the list goes on. Like, how do you even start to kind of figure out or sort through what that personalization experience should really even be?
So it's going to take a little bit more work up front, but the payoff and the results are going to be well worth it. I would say you're going to have to identify what users are going to be impacted and bring them to the table. And I'll tell you, the different units, those nurses, they don't have time to come to a design session or a meeting. That's why I always say meet them where they are because they don't have time to come away. But if you can just get a couple minutes with them, so that hands-on approach. walking around. You can use surveys, but a lot of times they're not going to fill them out. That's why if you're there in front of them, you give them a quick survey, or you're just writing down information after asking them some questions. That's where you're going to get it. Now, you might be able to get some leaders to come to more formal design sessions and meetings, but I find, meeting them where they are, and you have to include everyone. For example, I was working on a project, and they were like, well, you're a nurse. You can just figure out the design and workflows and alerts that the NICU's going to need, and the ER and all of them, right? I don't have that specialty background.
Lots of time to do that.
Yeah. I was like, I don't know how NICU operates. That was not my expertise.
Yeah.
No, we have to bring those nurses in because this is going to fail. So yeah, it takes more time. But like I said, you're going to be successful versus the opposite when people have not done that.
Yeah.
It fails. Adoption fails. It's wasted time and investment, and they have to go back to the drawing board.
Yeah. The intention behind the design is feels like such an obvious thing, and maybe for us in this room especially, because that's so much of the conversations that we're having with customers every day. So it's intention to make sure that the experience is tailored to that individual, and so that they're getting what they need. That's again, helps with productivity, makes their lives easier, and ultimately allows them to have a success at the end of the day. The design's one step of that, and that obviously aids adoption because somebody comes in and they're like, oh, this feels like it was curated for me.
Yes.
What else is kind of like the keys to the castle from an adoption standpoint in your view? Like, what keeps the and especially being in a nurse's shoes, like what keeps you actually coming back to say, oh yeah, like this is the system I know that is going to ultimately make my day more consistent or easier? Like, how do you show that like value ultimately at the end of the day? Like, what are the other elements that folks have to kind of take into consideration once they've gone through the initial design process?
Those frontline stories and insights, I'll tell you, it can change your entire perspective, and especially how leaders see and view the problem, and then ultimately the solution. And then when the different users, especially the frontline, they're involved early. Yeah. They give their, feedback, and a lot of times they're involved in the design implementation. They're like, wow, this is amazing because you guys listened to me. My voice was heard, and this tool was built for me. It was not handed or thrust upon me. So they're more engaged, and they like it because they had a say in it.
Yeah. And closing that feedback loop is also a really key piece.
Mm-hmm.
Yeah.
We heard you, and this is how we're solving for it.
Yeah.
Yes.
100%.
It sounds like frontline input is a really kind of key piece of advice you would give with systems that are looking to kind of create employee experience technology or build that technology. Is there anything else you would say is must do, must have as they're kind of starting from step one?
I think it's really valuable to establish governance committees for anything that you do. It kind of gives some ownership, and it creates a feedback loop. Some organizations do that, others don't, but the ones who create that have committees and have voices represented from all the different end users, that's what I've seen be the most successful. Tracking data and outcomes is very important, but I'll tell you, your data and the outcomes that you're seeing could be looking great on paper. Things could be going great in theory, but when you have a nurse, you go to talk to them and they say, well, this system makes my job a lot harder, and it makes me and my patients less safe. That lands a lot differently. So you're taking those stories and that feedback, it shifts the conversation into something like theory, into something urgent. So you're taking it from abstract to real and urgent.
Right.
I'm curious, and not surprisingly, so much in this vertical specific is so operational driven, because it's so important to, there's not a lot of time to spare, again, in between patients. especially in circumstances where, nurses are juggling maybe more patients than were, typically assigned, or, the inability for this industry specifically to really control the uncontrollables. Like there's just some elements of the day that will just happen no matter what, level of preparation you do. So it's not shocking that we've kind of focused in on like making sure that fundamentally, like operationally, it is sound and easy. What about the cultural components? Like, I'd be curious to hear, like, how have you experienced either, seeing clients that you've worked with, or, as when you're on the front line yourself, like, how has digital experience kind of like incorporated that cultural element at any point to make sure that nurses, like, they probably need a little levity at the end of the day.
Stuff, yeah.
Just to feel like it's like, doesn't have to feel so heavy all the time, because I'd be curious to hear from you, like what you've seen done well to just encourage that more than anything.
Yeah, well, the tech, we love it if it's simple and supports us and does what we need, and if it's connected. It. I feel like the culture is huge, and your tech should align with your culture. So if you want a culture where people feel free and safe and open and everyone has a say, I feel like the tech should reflect that. So, make things easy for them. The technology should align with that and support the way they work, make their jobs easier. I am a huge advocate for a single point of entry with fewer clicks. Please decrease the number of clicks.
Yeah.
And if you can package up some of that engagement, maybe a little bit of the fun stuff in with the access to the critical systems and tools they need, and like how they reach maybe their supervisor or their team members, I feel like that's all in one place. Hopefully that makes your day easier, your life easier, and your experience better.
100%
across the board.
Yeah. And I would love it to be accessible from anywhere, any device, anytime, because we're seeing more movement in healthcare, and you're seeing more care being delivered outside the four walls of the hospital. So, don't leave those staff just kind of in no man's land with no way to connect or communicate with everyone.
Yeah, and that actually brings up a great point of, there's obviously so many sub verticals that we're probably trying to encapsulate a little bit here into the conversation. When you think about that kind of like home health experience, like folks who are on the road, as clients that you've worked with, like, well, how do you have to approach? Like, you got to approach that so differently. Like, you have to, like you said, almost bring folks in a little bit. Like, how important is the digital experience in those circumstances versus, folks who are maybe seeing each other, kind of walking the halls kind of all day, every day. There's a different level of connection. Be curious kind of what you deem to be kind of critical for those, alternative, healthcare delivery. What do they have to kind of bear in mind?
Yeah, they want to feel supported and engaged, and like they're part of the team. And it's hard for them when, they're out there on their own, traveling around, seeing patients or whatever environment they're in. So having, the easy tools to use in the palm of their hand to be able to communicate and collaborate, get feedback, escalate issues, get the information they need to deliver safe patient care. Give feedback. I call it the gamification. I've seen that work really well, where you kind of give kudos to each other and you get quick feedback, and you can easily send a message to your leadership and access policies. I mean, it literally should be one-stop shop. We all have our devices that we use every day, and you can literally manage your entire life from your phone. Yeah. Why can't employees have that same experience with their work devices and those systems?
Yeah, huge. I mean, I sit behind a computer all day and I still want that,
right.
Maybe at the time it feels as urgent as a patient, but I mean, the reality is our day-to-day is not at that level of kind of critical nature. And it was still that the ease I feel in, knowing that if I have to go, drop my kids off somewhere or go do something quickly in the middle of the day, that doesn't mean I'm going to miss a deadline, miss a message, whatever the case may be, and like that just that kind of peace of mind of knowing that you can kind of operate in your day as you would normally, but not, put the, sanctity of your job or a patient at risk. Like it's just so critical. So,
Yeah.
I guess any parting words, like we've covered so much, and I think what you've really helped bring to light for us, Heather, is just that this just the importance of bringing these teammates along on this journey is just like it's a non-negotiable. Having, whether it's through roundtables, walking the halls, collecting information, involving them early, clearly, like that's again, table stakes.
Yeah.
Right.
Just generally like the day, like what that entails, it brings, just so much visibility to like the reality of the day to day, and that it's, there's going to have to be priority shifts when ultimately somebody is in need of care. And so again, controlling the controllables is just so important. So those, not having systems kind of be the burden, is very clearly a through line that we've, that you've helped kind of bring light to. Is any other kind of, parting words that you would have, an organization, listening to this that is kind of trying to embark on maybe a different approach to digital experience for their employees? Like, what else should they be really kind of thinking about, prioritizing, just elements of this kind of journey that should be top of mind for them?
Yeah. Well, as they know, they should be thinking about the future. I always say plan 5 years ahead. What are your staff and the workforce going to need in 5 years? Start planning for those shortages in nurses. How are you going to keep them, retain them, keep them engaged, deliver the best experience for them so that they stay at the bedside? Because I always say, like, we're not going to have anyone take care of us come, 2030 if we're short that many nurses. So give them a voice. Everything, I keep repeating that, but it's so simple. I mean, it really does not take much time just to go talk to people, like get involved again. And for nurses, my fellow nurses and other caregivers, you have to speak up, get involved, share your stories, your insights. You have amazing insights that most people don't have because you are on the front lines of care. We also know what the patients want and need, and that's very important too. Escalate issues, use your collective voice, because I think people now are listening, but they really need the perspective from those on the front line to drive real valuable change.
Yeah. I think if for nothing else, obviously COVID kind of brought to light, so many things and changed so many ways that we operate. But I think, I'll speak for myself personally, but I think many folks would say, like, it brought to light the weight of what these employees are doing every single day and what these caregivers have to kind of carry. It's a lot. And so, just again, like leaning into that as like you, as a nurse, knowing that you have, you've got probably more respect than you ever before for what you have to do on a day-to-day basis. Like, make it known what you need to do that work and do that work effectively. It's just, couldn't underline that point more in, having never been on the front line myself. So, that's awesome.
Seems like a big opportunity.
Yes.
It's huge. Yeah.
Well, Heather, we appreciate your time and your, words of wisdom, your guidance. This is, really enjoyed this conversation. I no doubt folks who are listening will have some good nuggets that they're writing down and taking away. If folks are interested in kind of, connecting with you and maybe having more conversation, maybe they're tackling some of these challenges themselves, what's the best way for them to kind of get in touch?
Well, you can find me on LinkedIn, Heather Hudnall, and then also through my company, The Groove, which is an amazing company. So yeah, either of those options would be best.
Wonderful. Well, we're looking forward to seeing you in a couple weeks here in San Francisco, at Workday Rising, hopefully to have more of these conversations, but can't thank you enough for your time. And yeah, until next time, we'll talk to you very soon.
Yes, thank you. Yeah, I will be at Workday Rising. Thank you for bringing that up. So we
Yes,
can
yes.
there as well.
Go see the team at the Groove at their booth, and come to our party. That's another big highlight for that week. So awesome, Heather. Thank you so much again. We appreciate it.
Thank you, Heather.
Thank you very much.